Dear students, welcome to Game 53. And in this class, I'm going to say something about the Pap Smear. This we have already covered in our exfoliative cytology under the chapter of neoplasia. I would like you people to kindly go back to R.A.T.S, cross-refer, get better marks. I hope you are able to identify these two insertions. Higher spatula is one. So this is a line diagram. Definitely you people can draw in your cervix or for cytology. This is a uterus over here, and this is the lip of the cervix, another lip of the cervix, and this is the vagina. So here I'm inserting an instrument which is called the higher spatula. Normally a sampling is required at the region of ectocervix and endocervix. Look at the shape of this one. It is like this because the gynecologist will be able to get a sample of the ecto-endocervical junction, which is mandatory because the tumor can become malignant. There can be metaplasia, dysplasia, etc. at this particular site, and sampling is required. So, coming to the components of the Pap smear, there are superficial cells, intermediate cells, and paramecial cells. Now, what are these arrows and circles showing? Let us see. Good. This is a smear. I mentioned the white arrow as the superficial cell. It is a large polygonal cell which has got a pink cytoplasm or a eosinophilic cytoplasm and a pycnotic dot-like nucleus. Large cell, small nucleus. That is how we identify the superficial cell. The intermediate cell, on the contrary, is slightly smaller. Compared to this fellow is smaller. The nucleus is more vesicular or larger. Look at this one, the nucleus is larger and the cytoplasm is pale bluish. So that is a classical picture of an intermediate cell. The parabasal cell, on the contrary, it is the smallest cell. It is not the basal cell. Just above that, we have got a parabasal cell which has got the largest nucleus. So the orange arrow is the intermediate cell, white arrow is the superficial cell, circle is the parabasal cell. I would like you people to kindly describe these cells. Look at this first picture. There is a mixture of two components. Large eosinophilic cells with pycnotic nucleus. This is the superficial cell. And another set with a bluish green cytoplasm, larger nucleus, which is the intermediate cell. Two sets are over here. Compare it with this. So here the cells are all small and they are having a larger nucleus relatively. These are the parabasal cells immediately above the basal layer. Usually you do not see that. So superficial, intermediate, parabasal cells. Now, what are the indications of a Pap smear? This I have already explained in the exfoliative cytology, but let us check up. This will definitely fetch you marks of important question. Routine screening. There is a program called the Master Health Checkup. So this is part of the checkup. To rule out any malignancy or infection, they will be doing this. To assess the hormone status. Earlier, this was done routinely. There is a phase called the estrogen phase, progesterone phase. Infections such as Trichomonas vaginalis. Fungi such as Candida species. Any other inflammation because of bacteria or infection. All these can be identified. Pregnancy also. Pregnancy. This can be identified. We see some cells which are called navicular cells. And threatened abortion. If the lady is going to go in for an abortion, the Pap smear can give us a warning. Atrophic smear, as we had seen in the earlier picture, can be there. Squamous metaplasia, dysplasia, carcinoma in situ, ascus, abnormal squamous cells of unknown significance, and malignancy. Example, squamous cell carcinoma. Kindly memorize this entire list. It is important for you. The microorganisms I said. So here I find that there is an arrow over here. These are all Trichomonas vaginalis. And at a higher magnification, they are somewhat pear-shaped. This is the nucleus. There may be some flagella which can be seen. And usually it has got a dirty color by which we identify. The background shows inflammation, not very important for us. Pear-shaped organism, nucleus, and then there are the flagella. Candida albicans. There are two types of this. One is a budding form, another is a pseudohyphae. Here I find that there are breaks in it. That is because it is multiplying by the formation of pseudohyphae. Two organisms we shall remember. And positive for malignancy. Look at these cells. Obviously, they are large, dark. Most important is large, hyperchromatic, irregular nuclei. So this is an alarm bell. Definitely the patient has got a malignancy. And so also this. Black is beautiful. Look at this picture. Large nucleus and multiple nuclei are seen. And it is somewhat undulating. Beautiful cell over here. And this we call as a tadpole cell. Like a tadpole, it has got a configuration. So this is a smear for malignancy, which can be identified by the Pap smear. See you in game 54.